Good afternoon and welcome to the Health IT Safety webinar series. Today's topic is a question and answer session on a roadmap for a National Health IT Safety Collaboratory. I'm Doug Johnston of RTI International, and I'll be a moderator for today's Q&A session. Next slide, please. As we get started, I'd like to quickly go over a few housekeeping items, introductions, and then an overview of the roadmap. Starting with housekeeping, for any questions today, please type them in the small questions panel located in the bottom right portion of your webinar screen. We'll be reviewing the questions and answering them throughout today's session. Please note that all telephone lines are muted and today's session is being recorded. Closed captioning for today's session is available at www.captionedtext.com, event number 2742281. Slides and a copy of the recording of the session will be posted at the project website, www.healthitsafety.org. And if you have any general questions about this webinar or any in our series, please contact us at healthitsafety@rti.org. Next slide, please. The Health IT Safety webinar series is funded by the Office of the National Coordinator for Health IT and is being conducted by RTI International, a nonprofit research institute, as part of a year-long project to develop a roadmap for a proposed National Health IT Safety Collaboratory. Additional information on this project is available at www.healthitsafety.org. Next slide. So as we get started, today's respondents include Dr. Andrew Gettinger, Chief Medical Information Officer from the Office of the National Coordinator for Health Information Technology and the project sponsor for this initiative. Mr. Richard Landon, who's the Director of Regulatory Affairs at QuadraMed and who's representing the HIMSS Electronic Health Record Association, or EHRA, on the Health IT Safety Collaboratory Task Force. And myself, Doug Johnston, Director of Health IT Policy at RTI International. One additional respondent may also join today's call. That's Dr. Stephen Stack, President of the American Medical Association. Dr. Stack represented the AMA on the Health IT Safety Collaboratory Roadmap Task Force, and we hope he's able to join later today after his prior commitment's done. Next slide. So today's Q&A session focuses on discussing a roadmap for a National Health IT Safety Collaborative, whose cover is pictured here. This roadmap and an audio recording of the original webinar reviewing each of its main components may be found at healthitsafety.org. To access the audio recording, simply go to the education section on this website. Hopefully, audience members have already had an opportunity to listen to the webinar recording. To get us started, however, I'll take 5 minutes to walk through some of the roadmap's key points. Next slide, please. So why do we need a Health IT Safety Collaboratory? This slide shows a series of reports leading up to the development of the roadmap that illustrate recommendations from prior U.S. Department of Health and Human Services Health IT Safety-related initiatives. These efforts provided a basis and justification for a center, or rather collaboratory, focused on understanding and providing solutions to health IT safety risks and hazards. The need for a collaboratory was also based on the growing evidence base on health IT safety-related risks and hazards, and the need for solutions to identified safety risks through a series of research. This effort reflects a commitment to support and build upon private sector efforts, ultimately leading to, hopefully, a collaboratory that focuses on shared learning and shared responsibility around health IT safety. Next slide, please. So the project's goals and objectives were to produce a roadmap for a National Health IT Safety Collaboratory using a planning process that solicits private sector stakeholder input. This project was conducted within a one-year scope, and it really focused on three things. First is convening a task force to develop and then ultimately disseminate a roadmap for a proposed National Health IT Safety Collaboratory, to conduct education and sessions such as the ones that we've held over the year on health IT and various topics on health IT safety, and also to conduct research and analysis related to health IT safety. So in addition to creating a roadmap, this project really focused on conducting programs and analyses that would immediately advance health IT safety related efforts across the US. Next slide. So getting into the roadmap, the Collaboratory's vision is pretty simple and straightforward: safer systems and better care using health IT. One of the proposed Collaboratory's main objectives was to help move the industry and public sector forward by providing a trusted space for convening research and sharing of resources related to health IT safety. The ultimate goal of the Collaboratory is consistent with prior work in this area, which is to use health IT to make care safer and to continuously improve the safety of health IT. Next slide. Through a series of discussions, the Health IT Safety Collaboratory Task Force coalesced around a number of attributes important for a safety collaboratory. And these are listed here and defined in more detail in the roadmap. Of note is the more practical and applied focus on health IT users and solutions to their issues, as well as the emphasis on a more open, transparent, and trusted space for health IT safety related activities. Next slide. So who are the stakeholders? The roadmap and the task force envisioned a broad range of health IT stakeholders as participants in the Collaboratory. And these include patients, providers, safety organizations, various types of health IT vendors and researchers, payers and insurers, government entities, and many others as well. The point being, a more broad and inclusive approach should be taken when developing the Collaboratory. Next slide. So what would the Collaboratory actually do? The roadmap describes 3 core functions, which ultimately focus on developing solutions to health IT safety risks and hazards. These are convening or assembling stakeholders to find solutions to high priority issues, research and the support of development of solutions, so collecting and assessing existing analyses of health IT safety event data, identifying existing solutions, and developing methods to better characterize safety-related events, and finally, dissemination, promoting and distributing Collaboratory work products, including solutions, as well as educational materials, and a directory of health IT safety-related resources. So a range of functions here, boiling down to convening research and dissemination. Next slide. The roadmap also includes details on how the proposed Collaboratory would operate and be funded, and ends with a series of considerations listed here. The task force intended the roadmap to be a starting point for a national Collaboratory. It doesn't cover everything, but provides really what the force felt were the most important things to focus on right out of the gate. The focus in the roadmap is on improving health IT safety, but the task force also felt that the 3 functions described, convening, research, and dissemination, would also apply to using health IT to make care safer. Ultimately, the roadmap process built a foundation for the Collaboratory, and should Congress decide to support this issue, we could rely on the existing relationships from the roadmap as a start to forming the Collaboratory. Next slide. So here's a list of starter questions, many of which I just went over. We're interested, though, to get to your questions. So I'll now go to the questions panel to see what kind of questions we may be getting from the audience and start to address those. Okay, Michael, could I ask you to read some of the questions we're receiving, please? Here's one. It's a comment, not a question, from Brian Blautha, and it reads, while electronic health systems can mitigate certain patient safety risks, those systems vendors must acknowledge that this collaborative will necessarily air some negative safety impacts that result from their software's design. So I think the issue there, and Rich, maybe you want to help respond to this. Could you talk a little bit about how the health IT vendors may view, what is issues that, regarding their software, the way that it's used, the way it's designed and implemented, that may have some negative safety impacts?
Sure, I'd be happy to. In general, the HIT software developers are very concerned on the safety of their products, and there's a great deal that goes on under the covers behind the scenes as these projects are developed and as the software is rolled out. And there's various testing modes, both in the within the HIT developer shop, but also with our beta clients, our customers who really kick the tires and look for things that our quality assurance may have missed before it gets into a production environment. So every rollout, the product starts in a testing environment at the provider site, and there's a lot of effort spent to make sure that everything is functioning well. So I think as we've seen in the context of the initial IOM reports, that the electronic world, the HIT software, is on the whole a lot safer than the paper world ever was. But what we're seeing is, besides not reducing the adverse event to zero, I mean, we've knocked off, what is it, in very round numbers, about 30% of the medication-related errors, and that was the biggest single component of the adverse events in that first IOM study, to err as human. But also, as we dig down, we understand that, again, with the pharmacy-related aspects, that 30% number, that's a net number. We've seen a lot of old errors go away, the inability to read handwriting, for instance, but we've also seen, to a lesser extent, new types of errors crop in, like selecting the wrong entry from a long drop-down list. So it's those types of things that the Safety Collaboratory will helpfully help bring all the stakeholders together and determine what are the priority issues and what can be done about that. How much is in software development? How much is in the quality testing, both on the developer end and the the end user, the provider end? How much of this is training? How much of this can be alleviated through more innovative design? Is there any aspect of this that is an unforeseen consequence of the regulation, either on the software developers or on the providers? So there's a lot of questions, and the concept of a safe space for all the stakeholders to come together, that list that Doug read earlier on, in that safe space, in a non-punitive, non-regulatory learning environment. And safe space, I think it still needs to be defined, but safe space means that we can have open and frank conversations. It does not mean that any of us are totally screened from the consequences of anything we've done. It just means that within the safe space, we can talk about it openly without adding additional burden to our own legal risks. So I'm not sure if that's clear, but it's a safe space is a concept where we can be open and frank without without reducing our responsibility, but also at the same time not increasing responsibility from what it is under the existing legal system.
Thanks for that, Rich. Andy, do you have any additional comments there?
No, I think Rich really covered that very well. And the themes that we surfaced in the roadmap are not new, and so it was great to see the concurrence with very thoughtfully done proposals and papers that predated this particular work. So I consider the roadmap confirmatory, and I'm pretty excited about it.
Thank you. Our next question from Jorge Ferrer is, how can we participate? So I'll start with a response on that one. Right now, we have the roadmap, and through Health IT Safety, .org, we invite anyone to come and email us and express their interest in joining or participating in the Collaboratory when it is founded. RTI has been collecting a number of emails and contacts from various organizations and individuals who are interested in participating when the Collaboratory is formed, and so would invite you to either email healthitsafety@rti.org or go to healthitsafety.org and you can access our email there. But reach out to us and let us know of your interest, and we'll be certain to include you on communications moving forward. Also, we'll include any information about the Collaboratory and updates on healthitsafety.org. Rich or Andy, can you add to that at all?
This is Rich. Yeah, let me just refer people back to the original presentation, and there's 3 levels of participation, and the concept of the Collaboratory is open to all stakeholders, anybody with skin in the game. And again, back to the list that Doug mentioned. The first level is, of course, governance, and that's going to be a selected subset of the stakeholders. Below that is the membership. That's any interested stakeholder that wants to participate as a member. And beyond the committees, the third level is a participant level, and that's just a more of an opportunity for people who want to, as I understand it now, and I guess this will evolve as if ONC moves forward with the actual deployment of a Collaboratory. But the participants would be those who are a little bit more casually involved than the members. And again, the time commitments, the financial commitments, if any, are kind of sketchily outlined because it is a roadmap, not an implementation plan, and those things will evolve. So I think that's a great question, and I think there's room for everybody somewhere within the Collaboratory. Andy?
Yeah, I think you both articulated well. At a minimum, I would hope that the output from the Collaboratory is disseminated very, very broadly. And one of the things that we observe at ONC is there's a substantial amount of information out there about how to implement, how to manage, how to decide what the issues are with health IT, and some of those are reflected in our safer guides that are posted on our website and other content. What we observe is the community using health IT and implementing health IT doesn't always take advantage of the resources that are out there. So the Collaboratory will be one of the roles of the Collaboratory will be to try and influence that and essentially get the message out and the word out. In addition to identifying places where there's holes in our knowledge, that we need to do a better job of solving some of the problems that are out there, whether it's how many charts should be open at one time, what are the pros and cons of having 1, 2, or more charts concurrently, do you make more errors when you pick a patient than if the chart is open, or if 2 charts are open or more charts, are you more likely to document inappropriately on the wrong patient? So those are the kind of issues that hopefully, just one example of the kind of issues that I hope the Collaboratory will address.
Thanks, Rich and Andy. And actually, Andy, to your last point, the next question is a follow-up from Jorge Ferrer, who asks, will you be measuring the usability implications of patient safety as they relate to clinicians' cognitive load when using the systems? So why don't I start by saying that usability was definitely an issue that was identified even in the formation of the task force and certainly in prior work. So we had, as members of the steering committee and the task force, usability experts, and usability was discussed as an important issue in some of the work group meetings and was mentioned in the roadmap as well as an important issue. So I know that certainly had attention and was included in the roadmap, but I can say that What exactly a Collaboratory might do in that area would, of course, be subject to the processes that we outlined in the roadmap itself, in terms of convening stakeholders, identifying the key issues, looking at solutions, and then hopefully developing and disseminating those. So, Andy and Rich, would you care to add to that?
Oh, this is Andy. I think usability is an essential issue for the Collaboratory to be concerned with, and I am struck by the incredibly good work coming out of the MedStar Group and the National Usability Center, as well as the work coming out of Texas. So, and there are just two examples of some of the research communities that are involved in this. It is very hard as a clinician, to provide patient care with all the complexities today, and the cognitive load of these systems is real. It needs to be looked at, and we need to find methodologies to diminish that, and where we can't diminish that, make sure that we try and find alternative methods to provide safeguards. It may be multiple individuals. I think about the examples of particularly high-risk medications like cancer chemotherapy, and making sure that not only the prescriber of the chemotherapy, but a second or third party reviews, endorses, make sure it's correct. So that is an example, again, of, that could be a recommendation that's used more broadly.
And this is Rich Landon. I'll just say that I expect usability to be a high priority issue. I do not want to forecast whether or not that will be among the issues that will rise to the top. The whole process of evaluating what are the priorities that the collaborative will address will be a process through the governance, and will be, hopefully, according to the roadmap, it will be looked at in terms of what is the evidence out there. And another question that the governance group will be asking is what is the potential for positively impacting the issue. So there's a lot of issues. The usability issue is one that we know is an issue, but until we actually find out the funding level and look at our stakeholder group and have this governance set up, unclear as to where usability will rank in terms of the projects that a collaborative would bite off.
Thanks, Andy and Rich, for those additional details. And Rich, I think you provided a nice segue. David Tao asks our next question, which is, how and when will the funding level for the Collaboratory be decided? Andy, why don't you start by addressing that one, please?
Well, we have brought forward a preliminary budget. The thought is that that would be initially funded by the federal government. That depends on Congress appropriating money for this purpose, and making sure that whatever authorizations are necessary for the various federal partners to move forward with this exist. And then subsequent to that, there will be a transition, once the director is in place, to the entity becoming self-funded, and that is proposed to occur somewhere towards the end of the initial 5-year period. The success and progress in that direction will be evaluated a couple of years into the project for the likelihood and feasibility of that goal being achieved. In terms of how did we come up with the absolute dollar amount, we looked at comparable organizations and the costs involved in achieving some of the projects that we believe will be done by the center or the Collaboratory, and getting us in the right ballpark space. If you read the detailed report, we also provided for some contingencies for if we couldn't achieve full funding, what would happen if we had less than that. And then there was a threshold below which I think the task force wisely recommended that that it may not even be worth moving forward without adequate funding.
Thanks, Andy. And just to note, those scenarios, those 5-year cost estimates are at 100% between 17.8 and 20.6 million to fund the activities at the center, and then at 75, 50% levels between 13 and 15 million, and then 9 and 10.5 million respectively. So all of that is detailed in the roadmap, as you note, Andy. Okay.
Doug, this is Rich Lamb.
Yeah.
Let me just add to that. The roadmap, for those of you who don't recall, it's a 5-year proposal, and it starts with 100% federal seed money, but it morphs over those 5 years to a more generically supported funding. It's self-sustaining, and what we're looking at is ongoing involvement and financial support from those stakeholders who actually will have benefit from the results of the Collaboratory's work. One of the things that impressed me and actually amazed me in talking with all the stakeholders during the process of this advisory group that I was on for RTI is how much is going on in different sectors. I mean, we talk about what ONC, FDA, AHRQ is doing. Those are more well known, but you look at what the PSOs are doing, what the vendors are doing, what the provider organizations are doing, what the states are doing, what the Joint Commission is doing, what the health plans, including CMS, are doing, and what the liability carriers are doing. There's a lot that's going on now, and I see one of the potential values, and again, this is me speaking, not representing anybody else's ideas, but I see a harmonization of some of those stovepipes. So for the same money that they're spending now or less money, those segments of the industry can support the Collaboratory and maintain and probably improve the value that they're getting for that money they're already spending. So that's the longer term view as we transition into the full public-private partnership and the self-sustaining nature of the financing of this Collaboratory.
Great. Thanks, Andy and Rich. David Tao asks a follow-on question. The recently announced ONC Health IT complaint process seems to be punitive, whereas the Health IT Safety Collaboratory aims to be non-punitive. How will the Collaboratory complement the ONC complaint process? Or might they be at cross purposes? Andy, would you like to answer that question, or?
I will take a stab at it. I don't necessarily agree with the premise of the question that the ONC complaint system that is just brand new, was announced in the past week or two, is in fact punitive. And it mirrors the FDA MAUDE database, and it mirrors a database that CMS has stood up as well. All three of which are vehicles to draw attention to various federal agencies with different responsibilities in the area of health IT. Clearly, safety is one. And I expect that my group will receive some of those comments, and we will do the best we can to field them in a hopefully non-punitive kind of way. We're not as compared to CMS and FDA, we're not really a regulatory agency per se, aside from that area where we do have regulatory authority that we've passed on to our ACBs relative to certification, which is voluntary. Although some would say not really, because in order to qualify for CMS reimbursement, you have to use certified software. It is, I really don't think the intent was to make it punitive. I'll stop there.
Thanks, Andy. And I would just...
This is Rich. Let me add on to that. I, of course, have a different perspective as a company that needs to comply and is subject to the non-punitive approach that Dr. Gettinger is alluding to, and we could have a good discussion about that, but I think that full discussion is outside the scope of today. How it is in the scope, though, is that the ONC process by which it can revoke the certification of an electronic health record, I suspect that is a bit punitive, but there's a whole process around there, so there's a lot that ONC will do in the interim before it gets to the capital punishment step of revoking the certification. And again, part of the vision is that the collaboratory is not regulatory, and it will not compete in any way, shape, or form with the agencies of the federal government that have a regulatory obligation. And the ONC system that we're talking about is a regulatory obligation under the Meaningful Use program, and that will continue irrespective of what the collaboratory does. And I don't see any conflict between where the collaboratory is heading and ONC's requirement to administer that part of the law and that part of the regulations. But I think the collaboratory will take a different approach and looking at some of those same issues, but figure out in a non-punitive and a learning sense, a true learning sense across the industry, not for any one vendor in particular or any one setting in particular, but how to translate the information, the knowledge, the evidence that's gained by looking at these issues not in the same light as ONC must look at it from the regulatory, wearing its regulatory hat, but in terms of how we make patient care safer, make the products better, and apply that learning going forward. So I think there's some of the issues overlap, but I do not think the processes overlap or conflict as we envision it in the roadmap.
Thanks, Andy and Rich. We have a little under half an hour left, and I'd invite members of the audience to submit additional questions, should they have any. We'll hold on for another minute or so to see if anyone in the audience has any additional questions for our respondents today. I would note again that if you've not had the opportunity to view the Health IT Safety Center Collaboratory Roadmap webinar, that's available on healthitsafety.org/education. That recording will provide you with an overview of the roadmap, and you can also access the roadmap on the site as well and review it. I would note that we will have a session at the American Medical Informatics Association in November, where we'll be providing a similar overview of the roadmap and discussing any progress that may have been made in forming the collaboratory itself. Okay, David Tao has an additional question. It's a follow-up to his first question about funding. Is there an estimate date when Congress is expected to propose legislation to fund the Health IT Safety Collaboratory, possibly in the Senate counterpart to 21st Century Cures?
I assume you're going to send that my way, Doug.
You know, Andy, I could try, but why don't you start? Thanks.
There's no specific time frame, and as most people realize with the breaking news today, there's a lot of fluidity in terms of what Congress is doing relative to funding the federal government, whether a continuing resolution will go forward, whether not. We have aspirations on the part of the administration. We have put the request for funding in the budget previously, and really seek to have additional conversations with our colleagues on the Hill when they ask to have them relative to the relative priority for this and the need for this. So we don't have a specific time frame. Now, having said that, none of the work that we've done to date will become stale. This really is very good work, and if it's not funded in the near term, we will continue to work to achieve funding at a future time, and perhaps even start to explore some of the other methodologies that we might be encouraged to adopt to achieve the goal.
Thanks, Andy. I don't know, Rich, do you have anything to add there?
No, I really don't, although as I was talking about before, there's so much activity going on in this space that I would think if it takes too long to get this organized from the federal perspective, private sector just may be able in a few years to take this concept and run with it and not have to wait on federal monies to get it started. That's a long shot, but again, one of the things that impressed me in talking with all the advisory board members from the different stakeholder groups, how much passion and how much enthusiasm, how much work is already going on in this space that I think longer term, something like this collaboratory is inevitable, irrespective of a roadmap or funding model.
Thanks for that, Rich and Andy. And Andy, just quickly, Yuri Kaglovsky asks, what breaking news did the previous speaker, did you refer to, Andy? And I think it's about a continuing resolution maybe, or lack thereof?
I was referring to Speaker Banner's resignation, and what I saw in the press is the expectation that resignation will facilitate having a continuing resolution go forward, when prior to that there was some concern about that. But that's certainly not an official government position. It's just what I've read in the press.
Right. Thanks, Andy. Bob Cawley asks our next question. Are PSOs involved in the operations of the proposed Health IT Safety Collaboratory? Why don't I start? Bob, we included as part of the task force members representatives from patient safety organizations, both a specific PSO as well as a PSO association. So I think that we definitely envisioned PSOs as an important part of the collaboratory. Would note, though, that one limitation in developing the collaboratory roadmap is that a collaboratory will not include operating or funding the operations of a PSO. That was something at the outset that was very important to clarify with various task force members, that the collaboratory would not be able to essentially operate or fund the operations of a patient safety organization. Andy or Rich, can you add to that at all?
No, those authorities rest with the Agency for Healthcare Research and Quality, AHRQ, and one of the rules by which we have operated are the federal rules that prevent a federal agency from passing on its authority to do something to a non-federal agency.
Yeah, and this is Rich. I concur with what you both said. The PSOs will be an important stakeholder of the PSO community, however that is structured when the Collaboratory actually initiates. But the Collaboratory itself will not be a PSO, will not replace the PSOs, will not compete with the PSOs, but like all other stakeholder groups, it will leverage the PSOs.
Thank you, Rich. And thanks, Andy. We have a little over 15 minutes left, and I'd invite the audience to submit any additional questions that you may have regarding the roadmap, the process, its contents, or next steps related to the Collaboratory. So I'll wait a minute to see if there are any additional questions for today's session. Okay. So I mentioned a moment ago, and just waiting for one or more additional questions, that we will have a presentation on the roadmap and the status of the Collaboratory at this year's American Medical Informatics Annual Symposium in San Francisco. The session is S20, Podium Presentations, Are We Safer Yet? That'll be on Monday, November 16th, starting at 8:30, I believe, in the morning. 8:30 to 10, specifically Pacific time. Okay. Well, I'm not seeing any additional questions coming in. So why don't we move then to conclude today's question and answer session. I'd like to thank Andy and Rich and all the task force members for their participation in developing the Collaboratory roadmap, and Andy and Rich especially for your participation in today's Q&A session and then in webinar 10. We want to conclude by thanking the audience as well for your thoughtful questions. Should you have any additional questions or want to learn more about how to get involved, please do contact us at healthitsafety@rti.org. You can also access at healthitsafety.org/education all of the webinars in this series, slides and audio recordings for most of those. So thank you again, and I hope you have a wonderful afternoon.